Spine problems are not always obvious. They rarely begin where the pain is felt. A symptom in the leg may actually originate in the spine. A slight imbalance in walking might indicate something deeper. Understanding the spine is not linear. It requires observation, pattern recognition, and precision. This is the foundation on which Stavya Spine Hospital is built. At Stavya, every case begins with a structured registration process and a comprehensive review of prior medical records. Patients are encouraged to carry all relevant clinical documents, MRI and CT scans, X-rays, blood reports, surgical histories, and current medication details. This consolidated background helps the clinical team understand the complete progression of a condition before the first conversation even begins. In this environment, time is not defined by speed but by sequence. What may appear as waiting is often the process in motion. Each case moves forward through deliberate steps, not toward speed, but toward clarity. Consultation at Stavya begins even before a patient takes a seat. Movement is observed, how the body walks, balances, and compensates. These are not casual observations. They are clinical indicators. At Stavya, every patient is seen by a spine associate, a professional trained exclusively in spine care. This distinction matters at every stage of what follows. A spine associate records detailed history and symptom progression. The specialist then interprets findings, correlates patterns, and builds toward a clinical direction. Not in isolation, but through multiple layers of coordinated input. When the clinical picture requires deeper confirmation, imaging is prescribed, not as a routine step, but as a targeted clinical question. At Stavya, the referral to diagnostics is a deliberate decision. Each test is chosen because it answers something specific. Clarity at this stage is not a luxury. It is the foundation of every decision that follows. At Stavya, diagnostic imaging is not a default. It is a direction. Our team is trained to know exactly what to look for and to choose the right tool to find it. Wide tunnel MRI, whole spine digital X-ray, open standing MRI, and bone health diagnostics allow us to evaluate the spine across both static and functional conditions. Every image has a purpose. Every finding shapes the next step. When your reports come in, we don't look at them in isolation. We bring together your clinical examination, imaging, and medical history to understand what's really happening. At Stavya, this entire process is supported by our proprietary AI-assisted platform, built not just for precision, but to help patients understand their condition better. It organizes your reports, highlights important patterns, and connects every detail into one clear, complete picture. It assists clinical judgment, so nothing important is missed, and every decision is made with clarity and confidence. Patients at Stavya have access to globally available evidence-based treatment options, empowering them to make informed decisions about their care. At Stavya, 6 Class 100 Integrated Operating Theatre Spine Suites represent the surgical infrastructure. Controlled environments built to minimize particulate presence and reduce infection risk at the source. Procedures here are supported by O-arm-based real-time 3D intraoperative imaging, robotic-assisted platforms, high-definition 3D 4K microscopic visualization with robotic control, and endoscopic technologies. These systems do not operate in isolation. The data flows, the imaging informs, the navigation guides, and the surgeon acts within a single connected environment. This is not technology as a feature. This is technology as the standard of care. At Stavya, treatment is not uniform. It is built around the specific nature and stage of each condition. Most cases begin with non-surgical care, spine-specific physiotherapy, rehabilitation, and structured pain management protocols. These are not standard physiotherapy sessions. They are delivered by specialists trained exclusively for spinal recovery. When surgery is the answer, it is planned with precision, guided by imaging, and executed through integrated systems. Clinical outcomes indicate that 90% of patients achieve up to 90% functional recovery within approximately 90 days, depending on the nature and stage of the condition. The direction is always based on one question: what will deliver the most effective functional outcome? Stavya's expertise is its team of experts. Every individual in this facility, surgeons, physiotherapists, OT teams, nursing staff, rehabilitation teams, and support personnel are trained specifically and exclusively for spine care. Patients enter a system where every person at every level has been trained to handle the spine with the precision it demands. At Stavya, every step has a purpose. We observe, we evaluate, and we advise, always with precision-based diagnostics. Every step is deliberate, every decision is reasoned, and every outcome is the result of a system built entirely around the spine.